Hello, hello. Thank you guys for joining our live. Thank you, Dr. Meridian.
You're welcome. Thank you for helping out today. You're busy today with live, huh?
Very, very.
Good.
So we'll wait for a couple of our joiners. Alright. Hello, hello. If you guys have questions, feel free to leave them down in the comments and we'll go ahead and answer them. Oh, wow. Hello, hello. No questions yet. Hi guys, if you guys have questions, you can leave them down in the comments and we'll go ahead and answer those for you. You have a lot of people joining your live today.
Okay, that's good. So I hope everyone's having a great Thursday.
Okay, there we go.
We're doing a live, getting asked a lot of questions about, just start off a lot of messages about labiaplasty, BBL. We have a special going on for it. It's a procedure that I'm doing now, combo procedure. So labiaplasty portion done with the BBL. How do you know if you're a candidate? Come in for an exam, send photos in. A lot of patients do labiaplasty for different reasons, cosmesis, or sometimes if there's irritation during intercourse, and then BBL for just to look, feel better. So how do you know if you're a good candidate? Come in, send us our pictures, DM us, call us, and we'll go from there.
Alright, so we do have a lot of patients just saying hello, that you're the best doctor, my doctor is the best, hello. Okay, so we do have one. Well, I want to get my body done by Dr. Scott so bad. Then come. Okay, more info on Lipo 360.
More info on Lipo 360. Okay,
what
so
areas does it include?
So Lipo 360, whenever I do any lipo or BBL, what does it include? Because some doctors may not do lipo the entire abdomen or back, but I do the entire abdomen, waist, upper and lower back. So do that, really try to contour the body as best as I can, as much as your body allows me to. Then with a BBL portion of the procedure, we take the fat, we grab from the hips and the butt. All right, and that's where the magic happens.
So we do have a question. So what is a good BMI to have for a tummy tuck?
So my BMI limit for tummy tuck, most of my surgery is around 35. Why don't I like to go higher than 35? Is really because complications increase. All right, this is when we can get blood clots happening a lot more common, infections go up. So that's why it's important to have your BMI under 35 to help ensure, help maximize safety, especially post-operatively. During the surgery is the easy part. So it's about the post-operative course, and that's why, kind of segue into other questions, how long should a patient stay here? Really, I recommend staying at least a week, 7 to 10 days. If I start doing, I do these triple combos now, at least patients staying at least 10 days in Miami to allow optimal time to recover, heal well, and go from there.
This one's funny. So my question is, why are you the best doctor?
Well, thank you.
Let's see. Is the procedure safe? So what procedure?
What procedure? Well,
is the procedure safe?
Yeah, so all the procedures I do are safe, all right? So sometimes we have questions about the BBL is the most common. Is that procedure safe? Yes, it's safe when it's done by someone who's trained in Brazilian butt lifts, okay? I'm a cosmetic surgeon, not a plastic surgeon. All I did in my fellowship training was BBLs, tummy tucks, breast augmentations. Plastic surgeons are great, fantastic. However, I wanted to focus more on the cosmetic side instead of the reconstructive side. So I did that fellowship, and during BBLs, I use ultrasound guidance. I know the anatomy very well, and I only inject above the muscle. And this is very important because in the older days, a lot of surgeons were injecting into the muscle thinking they get a better result. But since then, we've kind of disproved that. It's kind of a myth. We get equal survival, really good data out there injecting above the muscle. So really other procedures that patients may ask about safety profile. Tummy tuck, what's the most common complication with tummy tuck? It can be a blood clot, a DVT, it's a different type of blood clot. And that's when a BMI is over 35. It can happen, if the plication, repair the muscle wall is too tight. So those are some things I do during surgery, my technique that kind of alleviates, helps minimize that risk. Really the most common problem post-op are infections, all right, and then fluid buildup if the patient isn't doing massages. So that's why it's really paramount in the post-op period to get your massages, to take the antibiotics I give you, and go from there.
Alright, so I had a BBL 5 years ago, but weight gained since then. Can I go for round 2?
Yeah, if you have enough fat. How do you know? Just, come in for a consult, DM us, send us your pictures, and we'll go from there.
Again, we did answer this question. What is the highest BMI you work with? It's 35.
35.
Okay, would you prefer a hotel stay over or a recovery home?
That's a great question. Really, recovery home are sometimes better, especially if you're staying in a hotel and you don't have somebody with a medical background. A lot of times patients come with their friends, sisters, brothers, parents, and they don't have a medical background. And after surgery, you're going to be leaking fluid. You're going to have drain if you have a lipo, BBL, tummy tuck. You're going to be kind of miserable the first couple of days, all right? But it does get better. And it takes a trained eye, someone who is familiar with the post-op recovery phase for tummy tucks or BBLs or breast lifts to understand what is an emergency and what's not, what's normal part of the operation. So, recovery homes are very good. Do your research on them just like you would a surgeon or the procedure you're doing, so you make a good choice from there.
Alright, so how long after a lipo can you get another lipo done?
So I usually like to wait at least 9 to 12 months. Why do you want to wait that long in between procedures? Because you allow your body to heal. When you have liposuction, if you're going to do another round, at least 9 to 12 months. If you have a kid, I usually say 9 to 12 months also, so you allow your body to kind of get back to a baseline that you're at before pregnancy.
Alright, so actually this is one of your past patients. Thank you very much. I'm very happy with you, doctor. You made my dream come true. I am Brazilian.
Oh, okay, nice. Alright, glad to hear.
Okay, so hello, the best doctor. One question. With a tummy tuck and a BBL, how long do you recommend the faja?
So, faja I kind of leave up to the patient. I recommend at least 6 months. A lot of patients do 12 months after surgery to wear the faja. Sometimes patients get uncomfortable with it. But I think really the first 6 months are really important to keep it on all the time, even at sleeping. You can take it off to go out, to a dinner or to get intimate with your loved one, whatever you want to do, but put it back on when you're done.
Alrighty, so how long should you wear the lipofoams and ab board?
So again, I kind of leave that up to the patient. I say 3 to 6 months for lipoforms and ab boards. Just make sure that it's not too tight on you. The biggest thing with fajas is sometimes they may be loose fitting, and then patients really overdo it and get it very tightly fit. It's good to get a fitted faja if you can, but you got to make sure it's not too tight. You can still breathe in it, you're comfortable, because you can get burns from a faja after surgery.
Yes, we can. Doctor, do you recommend J-plasma?
If you're a good candidate for it. How do you know if you're a good candidate? Usually it's patients who have loose skin, who really aren't a candidate for a tummy tuck. And those are kind of patients that fit in that realm of patients that need to have some sort of skin tightening. Sometimes a lot of patients have weight loss, especially with the medication semaglutide, Ozempics out there, that need a little skin tightening. So that's when J-plasma can be used for that and help with results.
I do see a question here on the TikTok. Can you do a BBL and a tummy tuck together?
Yeah, do them all the time. So, BBL tummy tuck is probably the most popular combo I do. You got to really make sure that you're here. I like for at least 10 days if you can. Sleeping is a big issue after surgery. How are you going to sleep? So I'm kind of having patients rotate, sleeping on their backside and front side every other night. Really important. I don't like any of those recliners or zero gravity chairs because they can really put a lot of bad blisters on the side and butt area where those chairs kind of compress.
Alright. The lipo on the upper back, is it included or separate?
Absolutely, it's included. I'm not giving you a car without the keys to drive it. All right, so I'm gonna do lipo of your whole entire upper back, upper and lower back, your upper and lower abdomen, waist, sides. BBL, is to make your body look good. What's not included with the BBL or lipo 360 is arms, legs, or chin. Really, those are kind of extra areas that we can add if you're a good candidate for it.
So I will answer this one. Tummy tuck and BBL, yes, he does do. That was another one. How long is the surgery for a breast lift and lipo 360?
How long is this surgery? It's about 3 hours, 3.5 hours. Kind of just depends on the size of the patient, how big they are, how big the breasts are, kind of the higher the BMI, the longer it can take, but not always. So it's, you know, ballpark range 3.5 hours.
All right. Do you do arm lifts?
Yeah, do arm lifts. You know, I do gastric sleeves, and then when patients lose weight, you know, they need to have the excess skin removed. So do the arm lift, thigh lift, tummy tucks, breast lifts, any type of, you know, excess skin that you have, usually can take care of. Back lifts also.
All right.
You just have to be ready for that scar, because a lot of patients I don't think fully understand with the arm lift. You know, that scar is, you know, completely down here, it can go down in the axilla and the side of the body. So it's something that's very important to understand. You're trading, you know, removing skin for a scar. You're trading, you know, looking a certain way for a scar. So that's a bigger scar. We try to hide it in your clothing, or you conceal it and your arms are at your side, but it's always something for a patient to consider.
All right. I think this is a good one. So if you transfer fat to the hip dips, does the fat stay forever, or eventually does it go away?
No, so the fat will stay, you know, if you're doing stuff to maintain your results. Now, what influences results post-op? Patients, you know, not having any sort of diet, exercise regimen, patients getting pregnant, patients gaining weight, those can influence your results. Now, if a patient has a BBL and it's their second or third round, and say maybe they had smart lipo or cool sculpting, that's what can influence the quality of the fat and the quantity, how much fat I get out. So if it's a patient who's a first-time lipo, they're usually going to have very good quality fat, and a lot of it, and that fat's going to survive more. We usually say rule of thumb is, you know, anywhere from 10 to 30% of the fat is lost after surgery, and the hips are a difficult area because blood supply out there gets a little bit weaker compared to the middle of the butt that survives a little bit better. So it's just a tough area to graft, but for the most part, you're usually going to look a lot better after surgery than before surgery when I get done with you.
There you go. So how long do we have to wait to get a tattoo after a BBL or any procedure in general?
I would wait at least six to 9 months, let your body heal. But that's a popular question. Sometimes patients like to tattoo over the incisions, you know, to try to hide or conceal them. But I would wait, you know, around 9 months is probably a good mark to wait for to get tattoos over.
Do you give medicine for blood clots after surgery?
So I do to certain patients. I use a certain scale, it's called Caprini scale, that, you know, takes into fact, you know, patient risk factors, and it gives you a score. And if a patient has a certain score, we give blood thinners or not. If you have a family history of blood clots, you know, your mother, father, first degree relatives, brother, sister, then I'll give a blood thinning medicine. Usually I'll have a workup to make sure that you don't have any sort of weird blood clotting disease, and then we can go from there.
Alrighty. So can you transfer fat to the breast? If so, is it safe?
You can transfer fat to the breast. I don't like to do the procedure. I don't think it's a very good procedure. Sometimes, you know, a lot of guys can inject fat for the cleavage area of the breast with a breast augmentation when they're putting in implants. There's a famous guy, I think in Australia, who kind of makes his name from it, and maybe then it's good. I really haven't done it too much, and I don't think it's a great procedure long term. I think you end up losing it anyways, and the long term consequences of having fat in the breast, I don't think there's good data out there to say if it's good or bad. Does it interfere with mammograms when you have to get a mammogram at the age of 40? So I just don't believe in it. That's why I don't really do it.
All right. Let's see. So how many massages do you typically recommend after a BBL?
So any tummy tuck, lipo, BBL, I recommend massages every day for the first week, and then 2 or 3 times per week for 2 or 3 months after. Very important.
For a mommy makeover, do you reshape the stomach or just remove skin?
We reshape the stomach with the muscle wall repair, and then remove the excess skin that you can kind of grab below the belly button. Remove that. I guess I get asked a lot of questions about this hybrid tummy tuck I do compared to a regular tummy tuck. Really with this hybrid, it's a complete muscle wall repair, removal of lower excess skin like in a regular tummy tuck, but instead I don't make the traditional incision around the belly button. I detach the belly button from below, lower it a little bit, and it looks, a lot of patients like the way it looks better. So how do you know if you're a good candidate? Obviously, come in for a consult, send us your photos, and we can go from there to see if you're a good candidate.
I see one here. So how long is the recovery for a mommy makeover, typically?
So mommy makeover recovery usually is, you're going to be healing up to 12 months. But really the first couple of weeks are the most, important as far as healing, making sure you're doing your massages, getting your drains removed, taking the antibiotics I give you. So really the first, 4 to 6 weeks are really important. After 6 to 8 weeks, people can start getting back to, the gym, their normal routines, picking up kids, etc.
Right. Do you do BBLs and breast lifts together?
Yeah, I do BBLs and breast lifts together. We just got to make sure the breasts really aren't too large. But how do I know if you're a good candidate? Obviously, come in. I can examine you. I do some measurements. It's just really important with a breast lift and BBL that you're not laying compressing on your breast after, because that can kind of hurt wound healing and how you heal after surgery. So yes, I do breast lift BBLs together. Again, I'd like you to stay here in Miami, where the office is, around 7 days, and then we'll talk about how you sleep and all that stuff after.
And to answer a couple more questions, all right?
Okay.
When do you recommend the gym working out post a BBL and tummy tuck?
So 6 to 8 weeks. Everyone usually says 6 to 8 weeks. If you're a little bit bigger or it's a second time surgery, you need a little bit more time to heal, wait 8 weeks. But at least 6 to 8 weeks and no heavy lifting. Anything heavier than 5 pounds is what I recommend.
Okay, so this one says, well, Dr. Meridian changed my life. Can't wait to see you. The best doctor. How do we book a consultation? You can reach out to Dr. Meridian on his DM, or you can give us a call at Icon Cosmetic Center. Okay.
There you go.
Let's see. Result. Do you notice that your patient's hip fat transfer doesn't last? I don't know what you mean by that.
No, I haven't really, noticed. Sometimes, fat again may not survive. It's around 10 to 30%, but for the most part, patients are very happy. Operate a lot, and really, 99% of my patients are very happy and fantastic with their results. So, just look me up. You see kind of what patients say and talk about. So usually pretty good at making you look better after surgery than before.
How do I know if I have enough fat?
Well, I guess you kind of don't until you come in for an exam. Send us your photos again. I can examine you, make sure you're the right candidate. But sometimes patients with a BMI 17, 19, you're not sure, but you want to try to have liposuction. We do that and really try to shape, sometimes feminize those patients a little bit better. They're kind of straight like a board. So that's every patient's different. If you're a BMI of 19, you're not gonna have a butt. Like I don't know, Nicki Minaj or Kim Kardashian, something like that. So we have to talk then about expectations and what's realistic after surgery.
Alright, so we see here the goal. I'm 8 days post-op and I love my results.
Good to hear.
Alright, so do you do lipo on the stomach when a tummy tuck is done?
So I do it. I don't do it above the belly button. Why? Really, no surgeon should do that. Why? Because we worry about blood supply and healing of the incision. If you do liposuction above the belly button during a tummy tuck, and you push it too far, you can cause necrosis or the skin flap dying basically, and that is a pain to go through. So no, I don't do any liposuction above the belly button.
Alright, so this is a good one. Is a tummy tuck a must after a C-section?
No, sometimes patients can get away with just lipo. Sometimes you need a little help with J-plasma to help tighten the skin. It just depends how bad the skin laxity is, hangs below. And how do we know? Again, coming for the consult, send us your photos.
It says, hi doctor, this is Pablo and Claire.
Okay.
I say, thank you. Love Claire's
Oh,
breast.
yes. Okay. Very good.
And then the best. Okay, so a 22 BMI is still enough for a BBL. Again, he did say we have patients with lower BMI. Sometimes it's just to shape, right?
Yeah, absolutely.
Give a better overall contour. The best, Dr. Meridian is the best. Left me snatched.
Good to hear.
Okay, is it better to get a cell saver or not?
If you can do a cell saver, I think it's good. Whenever I operate on my family or staff at the office, friends, whatever, I usually like to have cell saver. I think patients kind of recover better, feel a little bit better after surgery, especially after lipo BBLs. You know, we're taking out a lot of fat. Patients will bleed, it's inevitable, and sometimes you can bleed more, and getting that blood back into you is the best, you know, medicine post-op. So if you can do Cell Saver, I highly recommend it. It's a great device. We use it all the time, very safe and effective.
All right. So how long should you wait after gastric sleeve to do lipo and BBL?
So I recommend at least a year. If you had a sleeve or you're on Ozempic, the weight loss medications, wait at least a year, because usually you can get your target weight and you're not fluctuating in weight anymore. Usually after a year you've kind of lost enough weight, then it's about maintaining, and then we can see, you know, how much skin has to be removed, what needs to be done, liposuction versus tummy tucks versus breast hog versus breast lifts.
Alright, so this one is gym after breast lift. How long?
Gym after breast lift, at least 8 weeks.
There you go.
So you can heal better.
So this just says, I'm scheduled with you in 2 weeks. Excited? She's excited.
Good.
Okay.
Excited too.
Alright, this is just a lot of patients saying, thank you. Let's see. I'm trying to find the questions. Okay, so how long after umbilical hernia repair can I get a liposuction?
You know, after umbilical hernia repair, it kind of depends if they use a mesh above or below the fascia, but usually you could wait 6 months after. It's probably a good timeline. There's not any good, you know, hard data out there for that, but around 6 months is pretty good. Just, you know, DM us, consult us, let me examine you and see exactly what they did with the hernia repair, how big it was, but usually it's not a problem.
Alright, why do you use drains after a procedure?
So I use drains to help decrease complications. The biggest thing after, you know, tummy tuck or liposuction, BBLs, is fluid buildup. That's why massages are so important. And having a drain helps facilitate getting rid of that fluid, and they're gone in 5 to 7 days. So, you know, I use drains to help decrease seroma buildup, seroma formation, which can, you know, be a pain to get them drained with a needle, you know, every couple of days. So that's why I leave a drain. They're not that bad.
Is it okay to travel back home 4 days post-op?
No. So it's not good to just come to Miami and then leave the next day. You know, I had some patients recently do that. You know, it kills me when you guys do that to me. So please, if you come get surgery, schedule in the time or reschedule whenever you have the time to stay here at least 5 to 7 days. You know, even some of breast hog, you know, yeah, it's a simpler recovery, but still you should allow yourself time to heal properly, so problems, complications don't come in.
Alright, let's see. Okay. If you're a type 2 diabetic and on Ozempic to manage diabetes, can you still do a mommy makeover?
Yeah, you can. As long as your A1C for diabetics, what do I look for if they're a good candidate for surgery, is A1C less than 7. As long as your A1C is less than 7, then you should be good to go for surgery. Consider all things else are equal.
Do you operate on men?
Yeah, all the time. Operate on man today, you know, today, yesterday, so all the time.
Alright, we'll answer this last question and kind of leave it at that. Alright. Should I stay away from certain foods the week before my surgery? A lot of patients ask this, but I don't know why.
I mean, there's certain foods, you know, there's certain foods that can interfere with medications that you take, but in general, no. You know, if it's something crazy, you know, ask us, but most part you can stick to your normal diet before surgery. Most important, just don't eat, you know, midnight before surgery, at least 8 hours before. So that's not a terrible idea.
Alrighty, well, thank you, doctor, for doing this live with us. I know you're a busy doctor,
Yes.
so thank you. If you guys do have any more questions, feel free to DM Dr. Meridian or on our page at Icon. Alright guys, thank you so much. Hope you guys have a
Bye, guys.
wonderful